Hi, my name is Taylor Carlson, and I'm a physical therapist here at the Rehabilitation Hospital of Northern Arizona. I'd like to talk to you today for a little bit about spinal cord injuries and how physical therapy and the rehab team here can help you overcome them. Some causes of spinal cord injury, usually we split them into two different categories, being traumatic or atraumatic. With traumatic injuries, some common causes are car accidents, acts of violence, unfortunately, and then falls typically make up the majority of traumatic injuries. For atraumatic injuries, we're looking at things like infections, abscess, or even cancer. There is a population that's a little more at risk for a spinal cord injury. Typically, males make up about 80% of all spinal cord injuries. If you're between the ages of 16 and 30, you're also at a higher risk. And then engaging in risky behavior. And that can be anything from excessive alcohol intake to drinking and driving, anything like that, that puts you in a higher risk for spinal cord injuries. Now, when we classify spinal cord injuries, we usually do so in a couple different ways, and each spinal cord injury is a little bit different. So when classify them, we look at the level of injury, and that can range anywhere from the cervical spine all the way down to the lumbar spine in your low back. And an injury can happen anywhere along the spinal cord. Typically, the higher up, the more impairments you'll see. So there's nerves coming off the cervical spine that help innervate your arms and your hands, and the lower down in the spinal cord, the lower the impairments. Aside from classifying the level, we also look at how complete the injury is. For complete injuries, the patient will have no sensation or no motor function below the level of injury. For incomplete injuries, there's a couple different ways we categorize it, but essentially the patient will have some muscle sparing, so some muscle activation below the injury, and then they may also have some sensation. So my role as a physical therapist is to look at and assess and teach strategies to improve a patient's mobility. So that can be anything from getting in and out of bed, getting in and out of a wheelchair, propelling the wheelchair, any aspect of mobility. That's what physical therapists do. And here at the hospital, we're part of an interdisciplinary team. So we work with physicians, other therapists, nursing to give well-rounded care. And with that, we try to educate not only the patient, but the family as well. We do family training and education on the secondary effects of spinal cord injuries and how to prevent those things.